The disaster known as Obamacare, as far as Democrats are concerned, is a gift that keeps on giving. Back of this article from the LA Times, November 2017. Headline, Insurers make billions off Medicaid in California during Obamacare expansion. They quote a guy named Glenn Melnick. He's a health economist, professor at USC. Quote, "These profits are gigantic. Wow," he said. Another one, Alan Sager, a health policy professor at BU. Isn't that where AOC got her economics undergraduate degree? Alan Sager, a health policy professor at Boston University, was surprised and dismayed. Californians are being wildly open-handed and excessively generous with insurers, he said. End of quote. Jennifer Kent, California's Medicaid director, said the health profit plans were higher than anticipated during the ACA expansion. I'm skipping. Quote, "In anticipation of another Obamacare rollout, officials in California and elsewhere have boosted their payments to managed care companies because they expected Medicaid costs to increase as newly insured patients rush to the doctor or ER room after going years without coverage. But those sharply higher costs didn't materialize, and insurers pocketed more money as a result, especially in California." The LA Times continues, "Moreover, California's payments kept flowing steadily even when patients fared poorly. Two of the most profitable insurers in California, Centene and Anthem, run some of the worst performing Medicaid plans according to medical quality scores and complaints in government records." They then quote Andy Schneider, a research professor with Georgetown University's Center for Children and Families. Quote, "If there is that much money sloshing around in California, then it's worth asking whether you could expect more in terms of performance. California officials acknowledge they need to do a better job of connecting money and quality." End of quote. And of course, the Democrats want to continue the so-called subsidies. These insurance companies' profit margins are skyrocketing, their stock is skyrocketing, and they're contributing a great deal of money to the very Democrats that want to keep the gravy train running. LA Times says, quote, "Investors have cheered the results. Shares in Anthem have more than doubled since January 2014. Again, this was written in 2017. Centene shares are up 50% since the company purchased HealthNet last year." Again, this is the LA Times, not a conservative outlet, talking about all the jack that insurance companies have been raking in because of Obamacare. And now, of course, this is a Republican problem. Here is what Speaker Johnson said, number 74.
This is a very important point. We were always open to sitting down to negotiate and talk through how to reduce health care costs. It's a crisis for the American people. The cost have skyrocketed. It's the Democrats who put us into this scenario. Remember, they're the ones that created the ACA. We call it the Unaffordable Care Act, because that's exactly what's been yielded. Since 2010, since they put it into law, premiums have skyrocketed. Some estimates 60% overall, and they're continuing to go up.
And this is a Republican from Florida, Mast. He said the same thing that Trump said. Give the money directly to Americans. Number 81.
I speak to people all the time about our federally qualified community health centers that do fee-for-service all across the country. They have sliding scales based upon people's income, and they don't necessarily have to pay a deductible in order to go and see these places because, again, it's fee-for-service. So if they're getting something directly instead of having to have it go to somewhere else, they're getting it directly into their wallet, into their bank account. They can use that, and they can take it directly for when they need care and ultimately save dollars. So I think it's something that's a real possibility.
For full shows, live and on demand, it's Salem News Channel.